share my, okay, okay, okay. Good morning, everybody. I'm really excited that you are spending your Wednesday morning with me. As Victoria mentioned, I will be discussing the US Pointer study results today and the brain health implications. Cognitive decline and dementia are growing public health challenges. In fact, dementia is now fully recognized within the UN Political Declaration on Non-Communicable Diseases as a major public health priority. So there really is an urgent need for risk reduction strategies that are practical, scalable, and effective. Which is why we decided to do the US Pointer study at the Alzheimer's Association. Dementia rates are rising, and prevention has never been more critical. Lifestyle factors like poor nutrition and inactivity increase risk. Early research shows that individual lifestyle changes, such as diet or exercise, can help. And the next step is combining multiple lifestyle changes to see if that offers even greater protection. With this growing challenge of dementia cases rising and promising early findings, the question then became, can we take what we know and apply it in a more comprehensive way? That's really where the finger study comes in. In 2015, the finger study, which took place in Finland, demonstrated that a multi-domain lifestyle intervention, including diet, exercise, cognitive engagement, and vascular risk monitoring, improved cognitive function in older adults at risk for dementia. This was the first strong evidence that lifestyle changes could help prevent cognitive decline. With this evidence in our hands, our leaders at the Alzheimer's Association, Dr. Maria and Dr. Heather Snyder, asked an important question. Can these strategies work in different countries and cultural contexts? That question then led to a call to action, building on the success of Finger, adapting the approach for diverse populations, and really launching US Pointer, a study designed to test these interventions in the United States, where lifestyles and healthcare systems differ significantly from Finland. With that foundation, US Pointer was launched with a very clear goal. Our aim was to compare the effects of two different 2-year lifestyle interventions on cognitive trajectory in older adults at risk for cognitive decline and dementia. This is about understanding which approach offers the greatest benefit for brain health. To answer that question, we really needed a rigorous study design. US Pointer was structured as a single blind, multi-center randomized clinical trial. We enrolled participants at 5 different clinical sites across the US to really ensure that we had diversity in our participants as well as their settings. Participants were randomly assigned to one of the intervention groups. This was to really ensure fairness and scientific rigor. The 5 sites were Chicago, of course, Houston, North Carolina, New England, and Northern California. And as you can tell, these sites represent different cultures around health and behavior. We had over 2,000 participants enrolled, and 30% of them were from diverse backgrounds. This is truly key because what we typically see in Alzheimer's and dementia research is that individuals from Black and Hispanic populations typically do not sign up for research. So this was very exciting that we had 30% reporting that they were coming from a diverse background. We enrolled individuals who were between 60 and 70 years old, individuals who do not exercise on a regular basis, and individuals who were on suboptimal diets. In addition, we were looking at risk factors such as whether or not they were African American or of Hispanic descent, if they have a family history of impairment, and then, of course, cardiovascular risk, cardiovascular health risk was another thing that we were looking at. The participants were randomized into two groups. We had a self-guided group and we also had a structured group. For each group, we were really looking at physical activity, nutrition, cognitive activities, as well as health monitoring. For the self-guided group, participants attended about 6 team meetings over the course of the 2 years that they were in the study. And during these meetings, they received healthy lifestyle education, tools for self-guided plans, encouragement around physical activity, healthy eating, and cognitive and social engagement. They also received health monitoring through receiving blood pressure checks and getting their labs checked on a regular basis. The structured group had a more intensive experience. They had 38 peer meetings in comparison to the 6 for the self-guided group. And during their meetings, they received education, goal setting, accountability. Their activities included aerobic, resistance, and balance exercises that they did at a local community facility within their neighborhood. They also received nutrition guidance, so they were following the Mind Diet. And we also wanted to ensure that, just like with the self-guided group, they were being challenged cognitively and socially. And their cognitive challenges were through home-based computer training. And so, theirs was a little bit more intense, of course, than the self-guided group. They also received medical advisor visits every 6 months, and they also got their blood pressure checked, their labs were checked. So, to really sum it up, the structured participants had more frequent meetings, more hands-on coaching, more accountability, while the self-guided participants had basic education and general support. The participants were followed for 2 full years, and their cognitive function was assessed every 6 months. And as you can see on the screen, there was the baseline, and then at the 6 month mark, and then at the 12-month mark, 18 months, and 24 marks. We were checking in with them. And at each of these time points, we used a set of memory and thinking tests to really track how the participants were doing over time. This gave us a very clear picture of whether the lifestyle interventions were helping maintain or improve cognitive function or slow down decline. Oops. Here is what we found. If you look at the graph, you will see that both groups actually improved over the course of the 2 years, the entire time that they were in the study. And this is really encouraging. And I hope all of you that are taking in this information are excited by this. We are all very excited about this. From baseline to 6 months, you can see that there's a really nice jump. And then you can see the steady improvement through months 12, 18, and 24. Both the structured and self-guided group followed the same trend. They both were moving in the right direction. And this is telling us something very important. Even making lifestyle interventions on your own can have a positive impact on thinking and memory. There is a little note that says some improvement is likely due to practice. This just means that people were getting used to these tests, and this is normal in studies like this. But even with that, the overall picture is really positive. So the big headline here for all of you is both groups improved over time. And from here, we can start to look at whether one approach edged one out. So here's the next exciting big finding from US Pointer. On the slide that you are seeing, you can again see the same two groups, the structured group, the self-guided group, but now you're looking at how the two groups compared over the full 2 years. What really stands out here is that both groups improved, but the structured intervention consistently came out ahead. You can see the purple line staying just a little bit ahead at every time point, at the 6 month time point, 12, 18, and 24. Again, this is telling us something very important. People do better when they have support, guidance, and some structure that is built around these lifestyle changes. It doesn't have to be strict, but having a framework really keeps people engaged and helps them to stay on track. So the takeaway here is really very clear. Lifestyle approaches work for everybody, but the structured version provided a significantly greater benefit when it came to cognitive function. Now, here's something really important about this extra benefit that we saw in the structured group. When the researchers were really digging into the data, they found that the advantage of the structured intervention was consistent. It did not matter who you were. The stronger benefit showed up across the board, regardless of your age, sex, race, or ethnicity, your genetic type, or even your heart health. So, what this tells us is the approach is broadly effective. It's not just happening with one subgroup or one demographic, it's supporting brain health in a wide range of people who are at risk. This is so exciting. This is really powerful because it means that this type of structured lifestyle support has the potential to benefit diverse communities in a meaningful and scalable way. And that was what we were really looking to answer at the Alzheimer's Association by bringing this study to the United States. I'm now landing this plane to really explain what all of this really means. When we look at pointed data along with findings from other large studies with similar participants, we are seeing an encouraging trend. The structured 2 year intervention doesn't just help in the moment, it actually appears to slow cognitive aging. And when we say slow cognitive aging, we mean by around 1 to nearly 2 years. That's a meaningful difference, especially when we're talking about brain health over time. In other words, what this really means, people who participated in the structured program held on to their cognitive abilities longer than we'd expect based on normal aging. This helps to reinforce the idea that lifestyle changes can make a measurable impact, not just immediately, but in the long run. And that's why studies like Pointer really matter. They help us to understand what's possible when people have access to guidance, support, and a structured plan. What is next for us? We are moving into a truly exciting phase. We have become a part of this global finger network. Just take a look at this map. This is incredible work that is currently happening. And as I noted at the start of my talk, it all started with the original finger study, which took place in Finland. Again, that study was the first of its kind to test lifestyle interventions for brain health. That study laid out the foundation for what we were able to do with the Pointer study. And now this work has gone global. It is happening in 71 countries with over 20,000 participants involved. It has become a huge movement, people. We are not just watching from the sidelines. We are actively collaborating, we are sharing data, and we are contributing to this international effort. We are all in it together. It's just truly exciting. So, what does this mean for public health? Well, just as a reminder, our participants were about 68 years old. 68% of them were female. 30% of them were from diverse populations. 30% were without a college education. Cardiovascular disease metrics were borderline high in these individuals. 79% have a family history of memory loss. 30% do have the dementia gene. In the United States, at least 35% of older adults do not meet physical activity requirements. 81% consume suboptimal diets, and 55% meet criteria for metabolic syndrome. I say all this to say we have a representative cohort in the United States. You might be thinking to yourself, Olivia, this sounds like a lot of work. How are you going to roll this out into the community? But also, what is the cost to do this? Well, here's the thing. The support that we provided during the study was expert guidance, but we didn't do this work for the participants. They did it themselves. Everything that I have talked about so far, the progress that we have made, the impact locally here, the United States, globally, the finger study, it all comes down to the effort and the commitment of the participants in these studies. They all showed up, guys. They put in the time, they made it happen, and we were just there to guide them along the way. What does this mean for the future? Well, the Alzheimer's Association is committed to taking these findings beyond the research setting. And I'm happy to share that the Alzheimer's Association has committed 40 million to support the implementation of the study's findings. This is exciting, and I hope that you're all clapping and screaming on the other end. I can't hear you, but I hope that that's what you're doing because that demonstrates how much we believe in this work and how much we want everybody to have this information at their fingertips. Part of this commitment is continuing to analyze data through ancillary studies that are ongoing. We also have an alumni extension that is taking place, and this is all the participants that were in the main study. We have committed to follow them for the next 4 years. We really want to take a look and see how their lifestyle has changed. How might that impact ultimately their cognition and outcomes? We have also awarded $1 million to 10 teams for planning grants to look at implementation projects specifically. And then lastly, on the implementation science front, we have issued an implementation science RFP for $15 million. So there's more to come on that. Here is a list of the 10 implementation teams. I wanted to share this list because I think it's important for you to see who is on this list and where they're located. This list does include some pointer sites that were part of the original study. It also includes healthcare systems at the community level. There are also university research institutions. And importantly, we have state public health agencies on these implementation teams to help design and deliver meaningful interventions in the community. we have a unique opportunity to take what we've learned here and ask, how do we use this knowledge to advance brain health and public health? As an organization, we are really focused on what's next, and that's building on our programs and interventions using the public health spectrum of prevention. This framework helps us to think strategically about where interventions fit and what programs are needed at each level to create meaningful, widespread change. One theme that runs through everything is community. Most of these efforts are community based because that's where real impact is happening. And honestly, it is our strength as a grassroots organization. The table that you're seeing on the screen is showing you something truly powerful. It is the intersection of people and science. And I do want to walk you through some of the examples so it comes together nicely for you. At the individual level, we have already developed a brain health assessment tool. You can access that today. It's called the Brain Health Habit Builder. You can just go to our website and you can look for that, and you can start to actually take care of your own brain health today with that tool. For community education, we have volunteers across the country who are starting to deliver new brain health programmatic educational programs that launched at the end of last year. In healthcare systems, we are creating training programs for providers. Through coalitions and partnerships, we are launching a brain health roundtable to bring stakeholders together and mobilize action. In organizational practice, we are introducing a community recognition program that will be called Brain Health at Work to help businesses improve brain health for their employees. And this should be launching sometime in March or April. And at the policy level, we're exploring how to secure government investment in implementation studies that can bring our work to communities nationwide. And this is a continuation of the movement that began with the finger study, and I keep bringing this back because it's really an important piece. But it's also a reflection of how much we've learned and grown as an organization over time. These programs show our ongoing commitment to people and science from global insights to local impact. I did want to share with all of you that when we released the study results, we also released an accompanying document, and you can absolutely go ahead and pull out your phone and scan that, and you can read that at your leisure. I'll wait a couple of seconds before I move to the next page for folks to get out their phones and scan that. But of course, these slides will be also available for you to scan at a later date if you're not able to do it now. This study was a result of robust collaboration amongst top research centers, universities, healthcare organizations. This study was led by Dr. Baker and a cross-functional team that were contributing across clinical, behavioral, and data domains. The Alzheimer's Association provided strategic leadership and support from our wonderful leaders, Dr. Maria and Dr. Heather Snyder, along with a dedicated program and outreach staff. Institutions such as Rush Medical Center, UC Davis, Brown, Baylor, provided critical site support and expertise. If you recognize any of the names on the slide, please extend your congratulations to them. It was a true honor to be a part of this work and to be able to get us to this place in history where, for the first time, we're able to be in community dispensing hope to all of those that need it. And then before I wrap up, I did want to, take a quick minute or two to share a very exciting project that we've launched here in Illinois, called the Illinois Brain Health Project and Campaign. Since we know that healthy habits can make a real difference for cognition, we wanted to lead by example and really put our money where our mouth is. At the heart of this project is a website called yourbrainwillthankyou.com, and please do visit it, which offers simple, practical guidance for people of all ages to protect their brain. It covers everything from physical activity, good sleep hygiene, cognitive engagement, preparing brain healthy meals. It's all very approachable and easy to use. And I really just want to give a special shout out to Victoria and the Department of Family and Support Services because they are one of our key partners in this work. And their support has just been immeasurable in helping us reach individuals and families across the state that need to know about brain health. And that is the end of my presentation. So I'm going to stop sharing right now to take in any questions that individuals have.
Okay, we can handle questions either by a hand raise, or if you prefer, you may put your question in the chat and I can read it for Olivia. Um, let's see if we have any hands raised right now.
Oh, I think people are celebrating the fact that we had positive results from the US Pointer study. Yes, very exciting. I have Laurel who is on my team on the call right now. Her camera's off, but just want to say that these results have been truly a game changer for all of us at the association. Historically, our work has been focused around, being there for families, raising awareness around Alzheimer's and dementia, making sure individuals are connected to high quality resources, information, and support. We're now moving into this very exciting space, and it's because of studies like US Pointer and others that are currently happening. We're now able to be in community dispensing hope for the first time, to be able to share that there are things that you can do, regardless of your age, today to potentially reduce your risk of cognitive decline and dementia. Game changer. We love being in community. We love sharing this message. And I hope all of you on this call will go back and share this wonderful message with your family, friends, colleagues. Get them over to our website, let them download that assessment tool. Like I said, it's called the Brain Habit Tool, I think.
Habit Builder?
Um, Habit Builder. Gosh, please go check it out, see where you are today, and start to take care of your brain.
Mm.
Mhm.
I did have a question about
Yes.
the 30% of your participants you said were from underrepresented groups, either
Yes.
Black or Hispanic. We
Yes.
also know that in previous studies, there's a health disparity between the health of people from Black and Brown communities and their higher rates of having dementia. Did you notice if there were any special targeted interventions to help those communities, or they just improved with the same
They did.
information?
Yeah, that was one of the things I did point out that was truly exciting about the results, for the individuals that were part of the structured program. What we found when we really dug into the research is everybody's cognition improved regardless of your race, your ethnicity, your age, whether or not you have the Alzheimer's gene. Everybody that was in the structured program, of course, the self-guided too, improved. So those characteristics had no bearing on the improvements that we saw, which is exciting. And that's some of the stuff that we've been wanting to know for a while because, you know, historically, Blacks and Hispanics do not participate in this kind of research. And, we've always wanted to know how it shows up for them. Well, now we have that data. So, yeah, this is for everyone, and everybody improved in the same way.
Do you have available the information that was shared with participants
Mhm.
for the types of things that they needed to follow, like in the structured group? Where would people find that
Yeah.
information if they too want to follow this type of a program?
Yeah, we do. We have that on our website. You can actually go to alz.org and just Google US Pointer, and it does give you the recipe that the participants followed. So the physical activity requirements, the mind diet, the health monitoring. I'm forgetting the last one, but you can go there and it will provide that information to you. I'm also happy to share that with you, Victoria, when we drop off. I can send that information on for you to share with the individuals that were on the call today and anybody else that might be interested. But yes, we do have that information readily available so you can start to adopt that yourself.
Okay,
Yeah.
wonderful. Last year for the Brain Health series, we did do one program on the a mind diet. So
Mhm.
that will be available shortly on our website for people to look at the presentation. But it's a wonderful program, Mind
Mhm.
Diet.
Yeah.
Okay. Anyone else have any questions in the chat that they would like?
We have a very shy audience here. Oh, Sarah from Rush is on, and she's sharing information on the Mind Diet. Thank you, Sarah.
Thank you. Okay. This is your opportunity to get specific with any burning questions about the U.S. Pointer study. Um,
Hi, this is Angie. I don't know if I may
Go
have
ahead,
missed it.
Angie.
I may have missed it, but how long was the study for? How long did the participants um, participate in the study?
The study was for 2 years.
Oh,
So they
two
were
years.
in the study for 2 years, correct. Both
Mhm.
groups, both self-guided and structured, were in that for 2 years. And during that time, as I mentioned, the structured group that had the extra intensive guidance, they had about 38 team meetings, whereas the self-guided group that were a little bit hands-off, they met about 6 times over that time. But yes, they were in the study for 2 years. And as I mentioned, we are going to continue to observe them for the next 4 years and see how things work out.
Okay, thank you. And their age range?
Their age range, 60 to 70 years old.
Hmm,
Hmm.
okay.
Did you have a control group?
No, we did not. Mhm. Oh, gosh. Either
Um,
I did such a great job presenting and
well,
no
Lisa
one.
has a question.
Oh,
Will
wonderful.
there continue to be updates on how participants are progressing after the study?
Yes, as I mentioned, we do have ancillary studies that are taking place, and we will continue to share that information as it comes out. So yes, please just continue to pay attention, to be tethered to this information, and you should see more information coming out. Yes, we're
Okay.
pretty good about that, but you can also always visit our website for any updates as well. It looks like
Okay.
Rachel has a question.
Hi, good morning, and thank you for the presentation. It was excellent. I popped on about maybe 5 minutes late. Did you talk about what some of the um, reasons were for these increase in dementia, Alzheimer's in older adults in this particular part in time?
Yeah, I did not quite. I mean, I started that way. We are seeing dementia cases on the rise, and there are a number of reasons for that. I think we are aging. Most people now are, we're seeing people aging longer. So that's some of it. Some of it too is just awareness. At the association, we do a good job about being in community and making sure that people are paying attention to the signs and symptoms. So, people I think are going to their doctors and, figuring out and finding out what's happening with me. We're also seeing improvements, honestly, in just diagnostic tools. So it's all those things that are coming together that are really shining a light on, how devastating this disease truly is. So, yes, that's some of the reasons why we're seeing these rates increasing.
Great, thank you.
You're welcome.
Your study had primarily people 60 to 70, but how early should somebody get started focusing on um, establishing these habits?
Right away. Right away. One of the things we say all the time at the Alzheimer's Association, it is never too early or too late to start thinking about your brain health. One of the major things, and this is part of the work that we're doing, Victoria, is we need to get to everybody. Historically, the work that we've done at the association has been targeted towards older adults. But because we're in this new era of treatment, they are therapies out there for those in the early stages. But then again, studies like Pointer are informing us that there are things that people can do today to protect their brain, and you can start at any time. So that message isn't just for older adults, it's for everybody. You can be 18 years old, you can be 85 years old. So starting is what's really critical for anyone. Yeah, so start today.
Okay. Any other questions? Feel free to just speak up. All right. Looks like we have a few New Year's resolutions that are going to start soon. Let's see. Stacy Kelly
Oh,
writes, I'm hearing more
Stacy.
seniors say they're receiving the cognitive assessments as part of their annual wellness exams. I know that it's something the association has greatly influenced. Very excited to see how the association's able to drive risk reduction to the public. Thank you for your work.
Oh,
Okay.
thank you. Thank you so much,
So
Stacy. I'm happy that you joined. I know her, so.
okay. And then we have another comment. My mother seemed to do all the right things, exercised regularly, loved to read daily, had a social life, ate healthy, and yet she was diagnosed
Mm,
with Alzheimer's at 72.
mm,
She showed signs earlier than that. We
yeah.
don't seem to have Alzheimer's in our family, but naturally, I'm concerned. Any thoughts on that?
Yeah, no, I completely understand. I know that there are people who have a family history that are, getting the test to see whether they have the gene. I mean, that might be something that you want to explore, you know, uh, but I think starting today with, if you're not already, obviously, taking care of your brain, adopting some of these habits that we discussed, moving your body more, following the mind diet, engaging yourself cognitively and socially, and of course, making sure that you are staying on top of, what does your blood pressure look like? If you have diabetes, do you know what your numbers are? Things like that. It's really just taking charge of your health today if you have concerns. And, what we find is one of our really core programs at the Alzheimer's Association is called the 10 Healthy Habits. And it's some of these things, exercise, eating well, protecting your head, things like that. Um, that program was built because we were able to figure out if people are adopting all these healthy habits, you can potentially reduce your risk of cognitive decline and dementia by 45%. So, taking care of yourself is truly something that I would encourage you to do today if you have concerns. But you can absolutely find out if you have the gene, if that's something that you want to explore, um, and go from there.
Now we'll move on to
To
Jan's
Jan.
question.
So I read a book. It's published by the Mayo Clinic. It's a very good book about dementia in general, which of course is the umbrella, term for many diseases that involve dementia. Alzheimer's is the worst, but or at least it's the most prevalent. And one of the things it talked about too was, and this is probably true of most, deadly diseases, is early detection is critical for treatment. So when you talk about testing, um, they're working on that like crazy, I know, to find ways of detecting beta amyloid, you know, and Lewy bodies in the brain. And one of the things they're working on is the possibility of a blood test. And wouldn't that be nice and convenient? The other issue, too, is the affordability of all of this testing. I mean, insurance companies, there's a few that will, if your doctor recommends it, um, based sometimes on your own symptoms or family history occasionally.
Mhm.
Um, is the Alzheimer's Association kind of pounding on that door too? Or, you know,
Pounding the door of coverage, just so I'm clear with your question.
Or for testing.
yeah, for testing and yeah, to be covered by insurance companies to make it
Yeah,
affordable.
yeah, absolutely. We have a really strong policy team. Just so you know, at the Alzheimer's Association that does incredible work. In particular, the policy team at the Illinois chapter. And honestly, this is a feather in their cap because the Illinois chapter, we have about 77 chapters across the country, but the Illinois chapter is the first chapter at the association that has been able to pass law that provides coverage for diagnostic testing, for the therapies that are currently available for those that are in the early stages, for folks that have state insurance. So that's about 4 million people that are able to access that. If you have insurance through the state, you are eligible to do that. We are continuing to work to hopefully get that out to the masses. But, a third of the state right now does have access to testing and therapies. Of course, if that's the route that you go down with your doctor, and they're able to get that covered through their insurance. So we're very excited. I know the Alzheimer's Association is continuing to do that work across all chapters. So it's something that is truly top of mind for us. But here in Illinois, we are truly the innovators because we're already working that out. So yes, we are continuing to try and ensure that people have access and are able to get these items covered through their insurance. Getting it done for the 4 million was truly a wonderful, large step. We're continuing to do that work. We're
So,
continuing to do it.
and so you think Medicare, Medicare is helpful with this too.
For cover, yes, you would have to. Medicare, I believe, does cover the therapies that are available. The diagnostic piece, I'm not 100% sure. And if Laurel, who's on my team, knows, please add that to the chat. I think you might have to look into whether or not Medicare covers that. Um, the testing. I should know that, but it's escaped me, so I don't want to lie. I would encourage you to follow up, or I can look into that for you and get that information over to Victoria,
All
and
right.
she can share that with everybody.
Yes.
Yeah,
Yeah.
Medicare also has the new guide program to
Yes.
assist people that are in traditional Medicare, Part A and B, with
Hmm.
dementia case management and
Hmm.
coordinating of services. So that's a positive thing that people can
It
get
is. Yeah.
help with that. And we
Yeah.
have two new questions. Laurel did answer for Molly, but do you have any
Okay.
additional information on the community education building brain health habits program? And then the other question is regarding sleep. Go ahead.
Okay. Yes. Laurel, if you could please add the habit builder tool. I think that was one of the questions um, that was asked, correct?
Yes.
Information on that tool.
And then
If
the
you
other
could add,
person wants to know if there's the sleep component to your study, and if not getting enough sleep can potentially be a factor as well.
yes. And I am so upset with myself because I do know that we received um, some information around that's one of the studies that's ongoing, and I believe um, we were able to see that good sleep hygiene does improve cognition. And if Sarah from Rush is still on here, I would love her to add to that if possible, because I know that was just shared, but I don't want to give the wrong information. Sarah, are you on? She might have dropped off.
Okay.
Okay. It was shared with us at the Alzheimer's Association, I think about a month ago, but I don't
She's going to
have.
look that up. Look,
Okay.
yes. What was the attrition rate for this study? Did you have anyone drop out?
We did. And this is a good question for Sarah, in fact, because she was the intervention director that would oversee that. I want to say, and I might be wrong, but for both studies, I think we were at about, I think 90% attendance. Is that correct, Sarah? It's been some time. I'm so glad I have helpers on this call to jump in. Thank you, Laurel.
So Laura writes that the U.S. Pointer Structured Health Lifestyle Program, previously shown to improve cognition, may also improve sleep apnea, blood
Ah,
pressure
okay.
regulation, and cognitive resilience.
Okay.
And then a link to the relationship with sleep.
Okay. Thank you, Laurel. Yes, we did have some people drop out of the study naturally. I think there were not a number of one or two, a few individuals that passed away. But we were able to retain a good majority. I want to say it was about 90% for both groups. Oh, 89%.
Okay,
89%. So
that's
I was
really good
close.
for any type of study. Yeah,
It
excellent.
is. It is.
Okay,
It is.
wonderful. All right, let's see if there's any last minute questions here. Uh, all
Hello.
right, well, go ahead.
Oh, I heard a voice.
Yes, good morning. Thank you for your presentation. I would like to ask you, I'm working in a memory clinic and we are Hispanic focused. So I would like to know if the brain health habit builder, if you have that information in Spanish, it is available in the website or do you have resources in Spanish?
We do have resources in Spanish for the habit builder. I'm not sure if they've been able to convert that yet, but we do have a number of resources and educational materials that have already been translated into Spanish. Yes, we have those. And if you do visit our website, you can take a look there and you should be able to see those. I'm also, if you see, I'm going to put my email in the chat so you can email me directly too, and I can make sure that I can get that information over to you. In fact, anybody who has questions or needs further information, I just put my email in the chat. Please feel free to reach out to me directly, and I will get you whatever it is that you need, or if there was something that I wasn't able to answer on this call, please reach out to me and I can be sure to make sure I look into the answer and get back to you.
All right.
Mhm.
Any more questions? All right. Not seeing any. I really want to thank you
Oh,
today, Olivia, for coming out and making sure that all the participants on this call have this wonderful information. It's so uplifting, and
oh,
it's nice to know that even
yeah.
if we can't totally get rid of Alzheimer's and other dementias, at least we could do things to improve our
Mhm,
cognition for as
mhm,
long as we can and
mhm,
to ward off as much of the controllable forms of uh, dementia. So,
mhm.
thank you so much for your time and volunteering to do this for us
Oh,
today. We really appreciate it. Oh, I do have one last note from Sarah. The
ah,
structured lifestyle intervention significantly reduced the number of respiratory disturbances during sleep related to the self-guided intervention.
okay.
Okay,
Yeah.
so
I
thank you
knew
for
there
the
was
work.
something and I didn't want to mess up exactly.
Hmm.
So it's always nice to have people in the audience like Sarah and Laurel who were sending over info that I did not know fully. So thank you. But yes, thank you so much for having me, Victoria. I would love to return. I'd love to return and talk more brain health or whatever is on people's minds. So please, please feel free to invite me again.
All right. Thank you
Okay.
very much. Hope you have a good day. Take
You
care.
too.
Thank you,
Bye-bye.
everyone. Bye-bye.